Hey, good morning, everyone. I'm Alan Rippin. I'm the Center for Active Living Director at Athens Community Council on Aging. And we're very excited to have Joe Weisenbaker here today. He's one of our Georgia Care volunteers. And going to talk about its open enrollment season with Medicare. And I know it brings up a lot of questions for people. And we wanted to bring you in, Joe, to answer some of those questions and give us some helpful information to navigate all that. So I'm going to hand it over to you, and we'll have time at the end also for questions as well. But I'll go and pass the mic to you.
Okay, thank you so much. Good morning, everybody. We're trying to do this in sort of a interesting hybrid manner. We have folks who are actually in our meeting room who are observing this on the screen at the moment. They're about 2 doors away from me. And we have you folks at home who are plugged in via Zoom. I'm in here because otherwise, if I were in the meeting room, I would have to be wearing a mask, and that can interfere with people seeing me. And well, everyone wants to see me. So anyway, I'm about to get started. This is a general session focusing on open enrollment with a very special extended session illustrating the use of the Medicare Plan Finder to try to identify drug plans, because that's one of the big issues that we deal with during open enrollment. So I'm going to try to bring up my desktop. And of course, I am struggling here. There we go. All right. Okay. We are screen sharing. And can everybody see the screen there?
Yes. Are you able to expand it to cover your whole screen?
Hang on here.
Okay. Move it over. Yeah.
That we're talking about challenge for me.
If you look over, pull it over to the right again like you were doing, and then there should be, I think it's the green button. If you hit that, it'll at the top left of the under preview.
Oh, okay.
Should.
It says you are screen sharing. Oh, under preview, the green button. Oh, a green button.
Your full screen.
Wow,
Okay,
how
nice.
crazy. Now,
Wonderful.
watch me mess this up. Okay, so we're here to talk about Medicare's Drug Plan Finder and to talk about open enrollment. And of course, you know, this is all brought to you courtesy of Georgia Cares, which is part of the Georgia Department of Human Services, Division of Aging Services. They're in charge of the SHIP program in the state, which helps people get answers to questions about Medicare. And of course, we have to also thank the Athens Community Council on Aging, who are hosting both this Zoom session as well as the physical meeting in the meeting room a couple of doors down, where I'll go after we're all done here. All right, just briefly, the State Health Insurance Assistance Program focuses on both Medicare education as well as education and outreach. And we do a lot of work year-round helping people enroll in Medicare, helping them get their footing in Medicare, helping people who are encountering challenges dealing with their Medicare plans, and getting answers to their questions. That's our job. We don't pretend to know the answers to everything, but we do pretend that we are pretty good at finding answers to things. So whatever we can't address right off the top of our head, we'll do our best to do some research and get back to people on. All right, so how do we go about making the best use of open enrollment? All right, open enrollment is an annual event with Medicare. It goes from October 15th to December 7th of each year. And it's time to review coverage options and make choices that are better meeting your healthcare needs for next year. And there are 4 big options that are available during this time. You can change from original Medicare to a Medicare Advantage plan, which explains the 50 pounds of Medicare Advantage advertising that most of us get in the mail this time of the year. You can change back from Medicare Advantage to original Medicare if you decided that Medicare Advantage isn't working to your advantage. You can change from one Medicare Advantage plan to another during this time. The one thing that we really try to keep people alerted to is anything where you are involved in signing up for a Medicare Advantage plan or a new Medicare Advantage plan, you really have to make sure that any physicians or other healthcare providers that you have an invested interest in trying to keep available to help you are participants in whatever plan you're thinking about enrolling in.
Mm-hmm.
And apart from that, the big topic today, under original Medicare, enrolling in a new Part D plan. Now, you could say, but I've been happy with my plan. I can't tell you how often I've heard people say that. And why do I need to worry about this every year? And the simple fact is, nothing guarantees that what works well for you this year will work well for you next year. And there are lots of reasons to think that. Plans can change their premiums, plans can change their deductibles, they can change the drugs they cover, they can change drugs from one tier to a different tier, and sometimes they do those changes in ways that makes the certain drugs more expensive under their plan. Pharmacies come and go from networks. If you've been using a particular plan at a particular pharmacy, you could find yourself effective January 1st, if you don't make any changes, going into your pharmacy and getting the sad news that the pharmacy no longer participates in that particular plan, whether it be a Part D plan or a Medicare Advantage plan. So you need to review the information available to stay up with that. And of course, prices for drugs can change. It almost seems inevitable, and it seems inevitable that prices for drugs go higher. I've very rarely seen drugs get less expensive. Now, this is intended to illustrate just how complicated things are when it comes to drugs and pricing in the Medicare system. This is drawn from a GAO report that was produced for Congress a few years ago, and it shows all of the participants that are involved in basically setting prices for things for you under a Medicare drug program. Down at the bottom, that's us, beneficiaries. Our connections to this whole thing is mostly through our pharmacies once we are actually enrolled in a Medicare drug plan. But that's only a tiny tip of the iceberg in terms of all of the people who have a role in both the buying and selling of prescription drugs, as well as in setting the prices. Pharmacies get their drugs from wholesalers. Wholesalers get their drugs from pharmaceutical manufacturers. Then they're off to the lower left-hand side are Part D plan sponsors, which can also include, in addition to that, Medicare Advantage plans. And then we have this strange thing right above there, the PBM, the Pharmacy Benefit Manager. And the simple fact is that most drug plans involved with Medicare make use of these people called pharmacy benefit managers who take on the role of helping plans come up with formularies, lists of drugs they cover, help setting prices for those drugs, help negotiating prices with pharmaceutical manufacturers, and help negotiating relationship with pharmacies. And the one thing I've got to tell you here, aside from the beneficiaries, every player in this system is playing within our wonderful free enterprise system. And all of these people are highly interested in maximizing their profits. And that is, to some extent, why every year things seem to shift so much when it comes to our prescription drugs. There's just a lot of players in the game. Most of them are invisible to us, and they all are interested in maximizing their profits. Okay, now, what is possible to save on your out-of-pocket costs when it comes to your prescription drugs in relationship to your drug plans? And it very much depends on the drugs you take and the pharmacy where you go to get your drugs. I recently took about 20 sets of drugs that are taken by actual people, and I went back in, as I can do right now, and took a look at 2021 prices and plans, and I figured out for each of those set of drugs, the absolute lowest cost option when it came to both identifying a plan and identifying a pharmacy. And then I looked at plan premium and drug cost projections going into 2022 to try to identify what would happen if you kept the same plan and the same pharmacy that worked so well in 2021 into 2022. Here's what I found. For 6% of those lists of medications, their best 2021 plan and pharmacy matched up with their best 2022 plan and pharmacy. 6%. 28% of those things that I found relevant to 2021 had situations where their best 2021 plans were being terminated, either going out of business or were being melded with another corporation, and so we're sort of shuffling. And that left 67% of those sets of prescription drugs for which it was possible to identify clear-cut savings involved in changing plans and pharmacies for the 2022 year. These represent, in effect, people. And this is certainly not a random sample, but I didn't choose any of these sets of medications because I thought it was particularly interesting. They were just sets that had been shared with me over the year, both by people I've helped and by people in other SHIP programs who had questions and asked me to kind of look into things as another pair of eyes for them. Of those people for whom savings could be talked about in a meaningful quantitative way, for a third of them, we had things between $1 and $200. Some of those were $50, some of them were $75, some of them were $175. 42% were between $200 and $1,000. And a lot of people I work with, any savings at all on their prescription medicines in a coming year are highly desirable to make. But for even people who have better incomes, the prospect of saving between $200 and $1,000 really gets people's attention. And of the remainder, 25% would, in changing plans in 2022, affect savings of more than $1,000 in relationship to what if they kept the same plan that they had going from 2021 to 2022. Many of these were instances where relatively expensive medications were being removed from plan formularies, and for people to have those medications covered, they had to do a dance to get into a new plan that covered those medications. Otherwise, they'd have to pay retail price for those drugs. So here we're having a brief pause. Does anybody have any questions that they want to ask at this point? Okay, I'll take silence as being not yet. All right, so what I'm planning to do now is to illustrate, I am hoping live, using the Medicare Plan Finder. And there are two ways to use the Plan Finder. One is basically anonymously, where you don't provide any distinct personal information, and you provide it with all of what it needs to help you search for better plans. And we're going to do a second case. If you don't log into your Medicare.gov, if you do log into your Medicare.gov account, which simplifies some parts of this. So I'm going to try to bring up my browser, and if I can do this without goofing things up too much, go to Medicare.gov. And of course, I don't type well when I'm talking to people. Okay, this is the Medicare.gov initial page. And what you can see is there's some information available, all sorts of things that are possible that you can do, including logging in if you were going to do that, but this first example doesn't do that. So I'm just going to click on the Find 2022 Health and Drug Plans. And lo and behold, we have our next window here. And rather than logging in, I'm just going to click on this Continue without logging in. And because of that, there are a few questions that have to get answered. Let's see. First thing is what type of coverage we're looking for. And what we're going to initially work with is looking for Part D drug plans. This works from the standpoint of looking at drug costs as well if you're looking at Medicare Advantage plans. So this process we're going through works equally well for those, though you have the whole issue of providers and physicians being parts of networks that have to be worried about far more so sometimes than the cost of drugs that you get. So zip code, I'm going to put in my home zip code, 30606. And Medicare says, oh, there are two counties that the 30606 zip code includes, and my county is Clark County. This is an issue because, generally speaking, plans are oftentimes, if they're not statewide plans, they're based on clusters of counties. And Part D plans can differ in terms of their premiums, depending on what county you live in. Medicare Advantage plans can certainly differ sharply when it comes to the matter of whether a plan might be available to people, because they typically define their service area county by county. Okay, some questions. Do I get help getting costs from one of these programs, either Medicaid, SSI, Medicare savings programs, extra help from Social Security? And the fact is, I don't get help. This is an important question to answer because if you do, the Medicare.gov plan finder can factor in cost savings that are tied to these other different cost saving programs. All right, now, do I want to involve my drug costs? Absolutely. It would be foolish not to, because everything varies so much in terms of what's optimal plans may be as a function of the drugs you take. So I'm going to say, yes, I want to see drug costs. And to do that, I've got to be prepared to enter in the facts about the prescription medicines I take. Okay, so I take, I'm lucky. I only have 2 prescription medicines I take every day. One is for my cholesterol, and that is rosuvastatin. And what you can see is, here I am, 5 letters in, and it, on a roll, shows me the drugs that perhaps I take that are in its list. And lo and behold, here's my rosuvastatin calcium. And I'm going to add that drug. And what I see next is, I guess what you might say are the typical dosages of this drug and the typical quantities and frequencies. You need to be aware that the dosage of a drug you're taking may not be the one that this thing defaults to. This one happens to be the dosage I take, but it's entirely possible to be taking stronger doses of rosuvastatin or lower doses. So we're going to leave that at 20 milligrams per tablet, and I take 1 every day, and I'm going to say that I fill my prescriptions for this
When I had to put a motor in that thing.
once a month. Do I have a question? Okay, then I'm going to click add to my drug list. And I've got one more, my blood pressure medicine, which is a weird brand name drug that my doctor found for me several years ago that does a great job controlling my blood pressure. It's called Edarbi. It's from a pharmaceutical manufacturer, I think in Japan. And the dosages that are possible for this, it's either 40 milligrams or 80, and I do the full 80 milligrams. And I take 1 of these every month. 30 of these every month, 1 per day. And I'm going to add that to my drug list. So here's my drug list. And if I were doing this for real anonymously and I had lots more drugs, at this point, I'd be strongly motivated to print this confirmed drug list. Because if you are using Medicare.gov site anonymously and you've spent a lot of time putting your drug list in, you don't want all the information about it to evaporate when you log off, not log off, but close your browser. So if we were doing this for real, I'd probably stop at this point and print this off, just so I would have it to make it easier for me to replicate it again in the future. Okay, done adding drugs. Now, I've got to choose a pharmacy, 1 or more pharmacies. And based on the zip code that I put in, it has identified a set of pharmacies within a relatively close radius of the center of my zip code. And what you can see is it comes up with things within a distance of a mile. One possibility, which I almost always include, is a mail order pharmacy. Most drug plans provide a mail order pharmacy option, and it's always good to know what the prices are through a given plan's mail order pharmacy. Sometimes it can be lower than prices available through brick and mortar drugstores that you go to in person. And if you're looking at filling prescriptions for things that you've been taking for a good long time and you know you're going to continue to take, it's entirely reasonable sometimes, if you can save money, to get some of those drugs filled at a plan's mail order pharmacy. So let's see, we have several other pharmacies readily available here. If the pharmacy you typically use isn't in this initial list, you can go up here to this distance filter and expand the search radius for pharmacies. I'm just going to set it to 25 miles. And there are, in and around my zip code, something like 110 pharmacies available within 25 miles. You might go, that's crazy, that's way too much to deal with. The important thing is that you pick one. Or if you only are interested in prices for mail order, just ignore that, having picked mail order, and stick with that. I actually use more often than not the Kroger drugstore on Alps Road. One of the things you need to be aware of is that there are lots of drugstores that show up in this list. For instance, CVS, which is part of a vast chain of CVS pharmacies. And while CVS pharmacies in one state may be charging a different amount for some medications than CVS pharmacies in another state, generally speaking, chain drugstores within a given reasonable radius of a particular place are all going to charge the same prices and participate with exactly the same plans. When you start to get into more local drugstores like Athens Pharmacy, you can find some different results because Athens Pharmacy is a local pharmacy, not part of a chain. But anyway, so I've got mail order pharmacy and Kroger pharmacy selected. I could choose up to 3 more pharmacies if I wanted to. For simplicity's sake, I'm going to leave it at this and then click on done. And that takes us to our initial results page. The default organization of this is it sorts all the plans that are available within this area by a combination of lowest drug cost for me plus the premium cost for the plan. And it turns out for these 2 medications that I take, the optimal plan for me in 2022 would be the SilverScript SmartRx plan, which has, because I know this, the absolute lowest monthly premium of all the Part D plans available to me in this area, and it has the lowest total drug cost. At my Kroger, my medications for the year under this plan in 2022 would cost me estimated roughly $1,740. If I wanted to use SilverScript's mail pharmacy option, I could get those same drugs for a big saving of just a little over $4. Not very much of a difference. And it reminds me that there is a $480 annual deductible under this plan, so that I might expect to have to shell out $480 before the plan's actually going to begin to help me pay for my medications. This is important here because of the drugs I'm taking. I'm going to look at details under this plan. And I'm going to look in particular at my drug coverage. Let's see. There's a lot of information here. It tells me things like overall what my total yearly drug and premium cost would be given this plan and those drugs, both at Kroger and at the mail order pharmacy. When I'll meet my deductible of $480, and the plan will really start helping me pay for some of this. Whether I would enter into the Medicare drug coverage gap during the year, and whether I would exit from it. So all of this stuff shows up here. It tells me as well my estimated monthly drug costs. So this says that in January, under this plan, buying those drugs at Kroger, I might expect to pay $239. Next month, the same. In March, because I will have begun to meet my annual deductible, the price drops to $119 for those drugs. And from April on to the end of the year, basically $117 per year. The way that mail order pharmacies work is that, generally speaking, everything they can, they fill on a 90-day basis. So the numbers here look vastly different, but it's because it presumes 90-day prescription refills rather than every 30 days. Okay, there's a little bit more information here that might be of interest when it comes to the cost of my medications under this plan at Kroger. And what we can see here is that the vast majority of the cost I would be paying for medications is going to be because of my blood pressure medicine, the Edarbi. The retail cost for 30 Edarbi 80 milligram tablets per month is about $238. And until I reach the deductible in my plan, that's what I'm going to be paying for that drug. On the other hand, the rosuvastatin is an extremely inexpensive generic medicine under this plan. And the retail cost for that might be expected to be about $1.75 a month. But under my plan, basically, all I have to pay is $1 each time I get that particular medication refilled. Things under the mail order pharmacy look a little bit different because it's based on 90-day refills. And what you can see is my 90-day refills of my rosuvastatin would only run me $3 each time. For my Edarbi, before I've met my deductible, that's going to cost me $712. Once I reach my deductible, a 90-day supply drops to $350. So let's go back to search results. And what you can see is that while we've been looking at the lowest total cost option for me, which is this particular plan with its monthly premium and its price for my drugs, there are a lot of other results that show up here. And they are ordered by this yearly drug and premium cost figure for the brick and mortar pharmacy. So there are a lot of different plans that cost a lot, different in terms of monthly premiums, and have impacts both in terms of my total yearly premium, but as well as my drug cost. And you can see those things go up as we go down. If I were a crazy person and went all the way to the bottom of this list on page 3, I would find my absolute most expensive option for my meds. If I were to be getting my meds at Kroger through the Mutual of Omaha RX Plus plan, I'd be paying about $90 a month for the plan premium, and my total outlay for plan and drugs for the year for those two medications would come to just a little over $4,700. And what do you get if you make a choice like that? You get the privilege of paying a ridiculous amount of money for everything you're doing. And part of that is that particular plan might not do a good job covering my medications. They may not be in its formulary. More likely, the problem is that really expensive plan doesn't have Kroger as one of the pharmacies in its network. So generally speaking, when you're doing something like this, it makes sense to kind of look at how things vary as you go down these lists of drug plans in terms of their costs. But what I tell people is there's no inherent reason not to minimize your cost. The one thing I do need to bring up is that SilverScript Smart RX minimizes my drug costs so long as I'm using the Kroger pharmacy, which is the one I started with because that's my typical pharmacy. Let's go back and change that. Let's remove Kroger pharmacy, adding another pharmacy, and just for the heck of it, let's see what happens if I were interested in using Walgreens. Well, the best plan for me at Walgreens isn't the SilverScript plan. It's actually the WellCare Value plan, which costs a little bit more premium-wise per month, but yields not too different total annual cost that I might have to spend out of pocket for my medication of around $1,780. The one thing that's worth mentioning is that the best plan for you very much will depend not only on your drugs, but will depend on the pharmacy that you're talking about making use of. And there are instances, depending on the drugs, where pharmacies can make a huge difference. And it pays to look at a fair number of pharmacies in the process. And as I said before, you can go back and you can actually include up to 5 pharmacies in your search. And what it will do when you do that is it will report out on the initial reporting place the lowest cost option found among all of the pharmacies that you've included. So here I've got Walmart or Walgreens. I could put in CVS, I can put in Kroger. Let's see, let's expand this search radius to get a few more pharmacies in. I could put in the Athens pharmacy. And because I'm not thinking the mail order is going to save me a lot, I'll just take that out. And here we have the results with 4 pharmacies in. And what you actually see is the same result I had before, because it turns out that among those pharmacies, Kroger actually yields the lowest cost. Looking at plan details, it becomes possible to look at actually how different pharmacies stack up. And what I find is that under this Silver Script plan, Kroger is so-called preferred pharmacy in network. CVS is a preferred pharmacy in network. Walgreens and Athens is a out-of-network pharmacy. And Athens Pharmacy is simply a standard in-network pharmacy. Generally speaking, preferred pharmacies tend to, under a given plan, offer lower costs. But that's not always true. It depends entirely on the drugs. So what I'm going to do is take a quick look at my total costs. Let's see here. Okay, let's just take a look at my yearly estimated cost for my drugs at CVS under this plan would be about $1,656. At Kroger, where I usually go, about $1,658. If I were fond of Athens Pharmacy, I would have to be willing to spend several $100s next year more for my medications under this plan. All things you need to be aware of. Okay, that's pretty much what I wanted to show you using the get into Medicare.gov and doing things anonymously. What I want to show you now is logging in and how that can save sometimes a lot of work. All right, so I'm going to log in. And because I've done this before, my browser remembers my user ID and my password to my Medicare.gov account. And I'm going to log in. And because I'm logged in, Medicare.gov knows that I am currently enrolled in 2021 in the Silver Script Smart RX plan. And it knows things about my Medicare coverage. If I've lost my Medicare card, I can print that out. But I'm going to go to Find 2022 Plans. So here we are, what we get when we are logged into our account. It says basically, hello, Joseph Weisenbaker. You should review your plan's benefits for 2022 because things could change. If you don't make a change, you will be enrolled basically in the same plan next year. One thing you need to be aware of if you get into this, if a given company is terminating a 2021 plan, it will automatically set you up to go into one of its own 2022 plans. But there is no guarantee that the plan that that company will have selected for you is necessarily a good idea for you. They don't look at the medications you take when they make those determinations, and they certainly don't look at any other Part D plans outside of their own company's offerings. So you really have to be mindful that if your company is making changes to your plan, you had better look really hard at your best options for next year, or you may well find yourself in a more expensive circumstance than you need to be. So I'm going to say, let's look at Part D plans. It remembers my zip code, and it remembers my county. And I will go with that because I'm not planning on moving. But if you were planning on moving, you could put in a new zip code. Say you were moving to Asheville, North Carolina. You could put in your Asheville zip code and select your county in North Carolina, and it would work right along just fine. But I'm not moving. Now, when you have used your Medicare.gov login, it remembers your drugs. And not only will it remember drugs that you have put in the past, it will go and find for you any drugs that you have recently filled using your Part D plan. And here it's looking, it's saying, these are all the drugs you filled in the last 12 months. And there's only one that shows up here, my rosuvastatin, because honestly, I don't get my blood pressure medicine through my Medicare Part D plan. I have a purchase option available at another drugstore that gets me my drug, that particular drug, at a lot lower price. All right, so we're back to drugs, done adding drugs. It remembers, not from my previous session, anonymous one, but from my previous logged in session, the drugstore I selected. And I had selected Kroger Pharmacy. So it remembers this. I could remove this and add some other pharmacy, or I could add additional pharmacies if I wanted to. I'll leave it go at this, looking at plans, and lo and behold, here's that same result that I had doing everything anonymously. My best lowest cost option, SilverScript SmartRx, with the same monthly premium we've seen before in the same estimated yearly drug plus premium cost. Okay, that basically takes us to the end of my prepared remarks. Let me go back into all of this stuff and skip all of the places I had put here in case the Medicare.gov website wasn't being cooperative.
Hello, can you hear me? Can you hear me?
Okay, does anybody have a question?
Can you hear me?
James, does anybody in the room have a question for Joe?
Though I'm going to be coming over there when I'm done with my presentation to take in person any questions from people.
Might be helpful for anyone who's online too.
Does anybody have any questions they want to ask?
Anybody virtually who is on Zoom and has a question?
Do you guys have any questions?
Quiet group today.
Okay, well,
Questions.
moving along with the presentation. All right, just to let you know, by way of review, where you can go to get unbiased information about any questions you have regarding Medicare. There's always the Medicare and You Handbook, which is available now in its 2022 incarnation. There's the Medicare.gov site that we just wandered through. It also has lots of information available for you to help get answers to any questions. Medicare is directly accessible through their phone line, 1-800-MEDICARE. I've had occasion to use those folks, and they're very helpful. And of course, Georgia Cares. Always happy to help people. We operate typically between the hours of 8 a.m. and 5 p.m. Monday through Friday. You can call that number and probably have to leave a voicemail, but somebody is going to do their best to get back to you within 2 business days. One thing you need to know about the hours of operation, once you're connected up with a volunteer Medicare counselor like me, most of us have, over the last year and a half, because of COVID, adopted expanded personal hours of helping people. I oftentimes find myself helping folks in the evenings or on the weekends, because that's just when it works out best for them to get answers to their questions. So that brings us to the end of our session today. This was brought to you by Georgia Cares and the Athens Community Council on Aging, and I will turn this back over to our wonderful host, who is welcome to say whatever she likes and bid us all adieu.
Thanks, Joe. We really appreciate you being here and being a great guide and navigator for us. This is not easy always. I mean, I do have a question about the technology piece. You know, many folks are not able to navigate online or have access to that. What do you recommend? I mean, it's a very helpful tool, and for those who can do it, what do you recommend for those who may not be able to?
I recommend that people call Georgia Cares, because we have access to that tool all the time. I find myself in helping people very often, spending lots of time figuring out what medications they take and helping them find the best plans available for them for next year.
Terrific. Wonderful. We're so glad you're there, you and the other volunteers. Thank you so much.
You're welcome.
Last thoughts, anyone, before I sign off? And Joe, I know you'll be joining the group in the room to answer any questions.
Right.
If anyone has questions afterwards, they can always email me and I can forward them to Joe and connect you to. So I think that, did I see anybody in here? Nope, we're good. Okay, well, thanks everyone so much. And thanks for joining us today.
Okay, bye-bye.
Thanks.